IOE 413, Professional Ethics Study Guide. Question 3 is about a hypothetical doctor. She's named Dr. Novel because she likes to create new medical devices. The statement of the problem is that Dr. Novel invents a new medical device and licenses it to a company. Part of the licensing agreement requires the company to pay the doctor a fee for each device sold. She sees a patient who may or may not benefit from the device. The patient has ambiguous indications for treatment. Dr. Novel has true, quotes, clinical equipoise about the treatment that involves the device compared to an existing therapy that does not require the device. Note that clinical equipoise is a term that means that the clinician honestly doesn't know which is the best treatment. There are no other differences in cost, healthcare resource utilization, or quality of life for the patient between the two treatment options, beyond just the cost, the additional cost of actually purchasing the device. So there is an incremental cost associated with the option of using the device. The two options are A, use the device in treatment, and B, treat with a technique that does not require the device. What dual roles does Dr. Novel have? Construct a list of good things Dr. Novel may value, and construct the loss model of dilemmas table for this problem. The dual roles here refer to the two roles that Dr. Novel has in this hypothetical. The first role is being an inventor of a device. The second role is being a treating physician. It is those two roles that can lead to a conflict. But by having two roles, you may have a situation where you can't truly succeed in pursuing both of those roles without a conflict. Second part of this is construct a list of good things that Dr. Novel may value. Now this is good in the sense of what Dr. Novel values. And let's hypothetically say that Dr. Novel would value providing the highest quality of care to her patients. That's kind of a no-brainer. Make money from device royalties. That's something that Dr. Novel might value. But also, there might be some value in living a life free of others perceiving her as being ethically challenged. Right? That would be good. That would be something that somebody might value, is having a life where people don't view you as being ethically challenged. And finally, Dr. Novel might value using the least societal resources to care for patients. Finally, let's use that information to construct the loss model of dilemmas table. So here's the loss model table. For the left, you see option A, which is treating the patient with the device. The things that Dr. Novel may lose from choosing option A is living a life free of others perceiving her as being ethically challenged. That when there's true clinical equipoise of no knowledge of treating with the device or not being clinically superior, then using this device in which she would receive royalties is a situation where others might look at that and see some ethical challenge. And so by doing that, this physician, Dr. Novel, would lose something of value to her, which is living a life free of others perceiving her as being ethically challenged. The other thing, and I said previously, was that hypothetically this Dr. Novel would view a good thing as using the least resources necessary to treat patients. And if that's the case, then one of the things that treating a patient with this device that costs money is that Dr. Novel would lose by choosing option A, using the least societal resources to care for the patient. On the other hand, if Dr. Novel chooses option B, then Dr. Novel loses making money from the device royalties, because that was stated in the hypothetical, was that this physician, Dr. Novel, receives royalties based on the success of this device. So either way, Dr. Novel loses something, loses different things by choosing option A or option B. But choosing either option, Dr. Novel loses something of value to her. That's the core conflict inherent in a dilemma, that either choice one makes, Dr. Novel loses something of value to her.